So you have a trach patient. What do you need to know? This slideshow will give a brief overview on daily care needs, the RT role bedside, and bedside safety. Each day your patient will need trach cares performed. These will include cleansing of the stoma and changing of the dressing and ties. The supplies you will need to assemble in order to perform your daily cares are a new set of trach ties, some swabs, gauze and saline for cleansing of the neck, and a new dressing for your patient. The trach ties should have a template available to be used to cut to size for your patient. If there is no template available, measure and cut as best you can and adjust once on the patient. Your dressing should be sized to the flange of the trach itself and cut with a Y incision to fit comfortably around the tracheostomy tube. Additionally, each shift, your respiratory therapist will perform a safety check and patient assessment. They will also be available to you to assist with any scheduled trach changes, answer questions you may have regarding your patient's trach, assist in any emergent situations, and provide any missing safety equipment, potentially being an ambu bag with a pop-off valve, spare trachs, or supplies. Another question you may have is, when is your patient's trach due to be changed? Trachs are changed on average at least once a month or per doctor's order. You can find trach change information in two places. One is on the trach profile sheet. If the trach has been changed in hospital, it'll be notated at the bottom of the form. The other place is within Power Chart under the trach tube assessment. This will notate the date the tube was last changed, if we know it. Your respiratory therapist should monitor this, but if you have questions, you can always access it either of these ways. Now that we know when your trach needs to be changed, the question is often, who will change the trach? For scheduled changes, your respiratory therapist can be contacted via pager number 7377, and they will coordinate a time with you to change the trach out. If this is an emergency situation, bedside nursing can change the trach utilizing any of the spare trachs bedside. The tracheostomy profile sheet is a bedside reference tool filled out by the respiratory therapist at the time of patient's admission to the hospital. Included on this are the brand and size of the trach that the patient currently has, whether or not the length is standard or custom. At the bottom of the form, you will see trach number and when it was changed last. And it also will let you know if your patient has a critical airway, if they can be bagged from above, or if the trach tube itself is MR conditional for scans. Also included on the trach profile sheet is suction information located in the upper right-hand corner. This will give you what catheter size you should be using and the depth of suction. Suctioning is determined by RT measurement of the interior of the shaft of the tracheostomy tube, the measurement of the exterior portion, and the addition of 10 millimeters in order to clear the base of the trach to ensure patency and effective suctioning. Please only suction to the depth notated on the card. One of the safety checks the respiratory therapist will do while they're in the room is something called a MASH-T. What this stands for is a series of items that should be in the patient's room with them in order to ensure safety. The first of these is cardiac monitoring or an oximeter. The second thing we look for is the presence of a self-inflating bag with a pop-off valve. This will be different than the bag contained in the clamshells in your room and should be with your patient from admission along with the profile sheet. Suction equipment will also be assessed. We're looking for correct catheter size and function of the canister. Humidification can be achieved one of two ways: active humidification via a trach collar and an Venturi aerosol device, or via a HME, which is a heat moisture exchanger. The active humidification provides optimal humidity for your patient. The HMEs can sometimes be drying and should be monitored frequently. The final item that should be checked is to see that we have trach tubes as backups for what the patient currently has. One tube at the bedside should be the same size as what the patient currently has in, and the second one should be one size smaller if available and of a comparable length. These tubes should have been delivered at the same time by RT as the profile sheet and the self-inflating bag. Now that you've viewed all the slides, you should be all set to have a great day with your patient. Happy traching!